Welcome to A Really Good Sex Chat, a podcast aiming to open up conversations about disability and sexuality. I'm your host, Candice Care-Unger, psychosexual therapist and specialist social worker at Care Rehab. Join us as we have frank conversations about sexuality, disability, fertility, pleasure, dating, and everything in between. This podcast is brought to you by Care Rehab and recorded on Darug land. In this episode, we talk with Dr. Emily Bray. Emily shares her story of motherhood after a spinal cord injury in her 20s. We talk about dating, fertility, pregnancy, birth, infant care and parenting with a high-level spinal cord injury. The lessons Emily has learnt along the way that have helped shape her understanding of what makes for a great mum and challenge community assumptions about what parenting is. Hello, Emily. Thank you so much for joining us today. How are you going?
Well, thank you. How are you?
I'm good. It's nice to see you again. It's been a while now that you've moved to sunny Queensland. So today we're going to be talking about pregnancy, birthing, parenting, everything that kind of comes with fertility and all of the family planning stuff. So thank you, Emily, for coming to have a chat with us today. For people who maybe don't know you already, could you introduce yourself?
My name is Emily. I sustained a spinal cord injury back in early 2012. It was a snowboarding accident over in the States. Nothing wild, just an unfortunate accident. I, at the time, sustained what's classified as a C4, C5 complete quadriplegia of spinal cord injury. After that, I did return back to Sydney and I completed all of my rehab at Rural Rehab in Sydney. And then following, getting out of rehab and focusing a little bit on recovery and return and adjustment, and then kind of had a bit of a career change and returned to study and retrained as a social worker. And I've worked a little bit in peer support while I was doing that. And then I worked a little bit at Rural Rehab as a social worker.
Yeah, Emily was one of the social workers on our team. And then you left us to go and be a PhD student, hey?
Yeah, I decided it was advertised. I thought, throw my hat in the ring. I wasn't really sure. Obviously, I love social work and I was really enjoying it.
I think when I hear you say, I just saw an ad for a PhD, so I just threw my hat in the ring, I think that is a highlight really to how smart you are. You're a bright cookie to just kind of on a whim decide to do a PhD. There was something about that question that was interesting to you though, right?
Yes, absolutely. So the question for the PhD was looking at how can we support young people with spinal cord injuries as they transition from pediatric to adult healthcare. I was particularly interested in getting into the research side and then to see a PhD that was focusing on spinal cord injuries, not necessarily the physical functioning of spinal cord injuries, but the psychosocial support of people with spinal cord injuries was what interested me. I knew as I had my injury when I was 22, so I knew I didn't have experience of being in the pediatric setting and going through that process, but I still felt like my experience and my knowledge and my background as a social worker, it gave me a good knowledge and understanding of the area that I thought would bring some insight into the topic. It was kind of where my interest lay, why I thought, let's see if we can do this.
Yeah, totally. And I mean, and 22 is not, like, people aren't that established, like in terms of their career and their finances and their families. Like 22 still easily can regress to, no, I need my mum and dad and I need my family, and it's normal. That's not no one's expecting a 22-year-old to be fully adult.
Yeah, absolutely. And I think at the time, like I was overseas. I think I was just trying to find myself in who I was and my place in the world. And I had done a degree, but I wasn't really sure that it was what I was interested in and where I wanted to take my career. So I was kind of using that time to figure that out. And then I had an injury. And you do kind of, you're thrown into this world where you know nothing. You're thrown into a healthcare system, which I had really very minimal experience with. And then you're expected to understand how it all works and also come to terms with what's happened. So, yeah, you do, in a way, regress a little bit into, if you have that family support, into, a child role. And my mother was very supportive and she's a nurse. So having her there was kind of instrumental in that journey to kind of say, okay, well, I'll focus on recovery if you focus on managing all the doctors and the health jargon that comes with the injury. And then
Teamwork.
you can relay it back to me in a way that I'll understand.
I kind of see, having worked in this space for 20 years now, that the 20-somethings, exactly what you're saying here, haven't established themselves, don't really have a full identity. And now they're like, now quick, reinvent yourself. And you didn't even really know who you were or what you were going to do with yourself. And so it's a really interesting time point, which is both in some ways a blessing because people aren't ingrained in who they are, like to be able to reinvent themselves, but in other times can be also a big challenge for folks who are feeling particularly vulnerable at that age anyway. So you reinvented yourself into a social worker who did a PhD and then somewhere along the line got back into dating, I guess. That's probably part of your personal story. What did readiness for dating look like for you?
I think that I had got to a point in my recovery where I'd come to realize that perhaps this function and this recovery was what I had, and I was not going to recover anymore. I could gain strength and I could gain, the ability to do some tasks, but I was not going to walk again. So I'd come to terms with that. And I had embedded myself in study, and I had a good social network. I'd got to this kind of quite comfortable place, but perhaps that was it. I was comfortable. And I got to a point and I thought, well, I need to get out of my comfort zone a little bit and maybe just start exploring, what else is out there. And that's, I think, I started looking for a job at the same time. But then one of the things I said to myself is, maybe I'll go on a few dates. And I set myself a New Year's resolution where I would go on 4 dates for the year. And I thought, if I go on 4 dates and they're terrible, that's fine. At least I have a story to take back to my friends and discuss over a cocktail. And that was kind of my point. It was less about the dating and more about let me just get out and do something different, because I'm not that I was stuck in a rut, but I was just, comfortably living life. So I kind of set myself this goal, essentially. I went on 3 dates in like 20 days. The third one was with my now husband. And so it ended up being not as hard as I thought it was going to be, but also didn't exactly go the way that I had anticipated. I didn't have any funny stories to take back to cocktails with my friends. It was kind of a really good experience. But
So did you do online dating?
Yes. So I did Tinder. So when I kind of realized that this was what my goal was going to be, I thought, well, how do I do this? And this was 2016, and I think it was the height of Tinder at the time. I don't know what people are using now, but so I thought, let's go on Tinder. It seems to be what people are doing. I made the active decision to put myself out on Tinder as a person with a disability in a wheelchair. So I had my profile picture, and I had a little spiel, a little joke as well about being in a wheelchair. Because I thought, for me, I know people will look at that and make a decision for themselves about whether they are interested or not. And I know that's going to happen anyway, but I don't need to be part of that process. Like, I don't need to start a conversation with people and then be like, we're getting along, then have to break, this, I have a disability, then be told, actually, that I'm not interested. And that's fine if they're not interested. That's their decision. But I don't need to be part of that process. So I made the decision to put it out there and kind of use it as a filter. And then I figured then at least people that do contact me, at least they've gone through that and they're open and willing to explore me as I am. And I know that decision is different for everyone, and everyone can make different choices depending on what they're comfortable with. But that was my decision when I decided to do online dating.
I mean, that's something that comes up a lot in my work. It's like when to disclose, how to disclose, do you need to disclose, what's the best way to do it, et cetera, et cetera. I am of the same opinion that sometimes it's easier just to put it out there right at the very beginning and let nature do its selection, because if people who have an issue well, you don't need that in your life either. So let the photos do the culling kind of thing. Yeah. Okay. So 3 dates is the charm. That's Emily's advice to get out there. I mean, there must have been something kind of fun about that first meet that you thought, oh yeah, this is someone worth getting to know.
Yeah. I met with 2 other guys before I met my husband, all of which were perfectly fine dates, but they were just fine dates. But then I met Scott and the conversation flowed naturally and we wanted to like continue the conversation. And it was, out of the 3, it was the one where I thought, actually, I would like to see this guy again and continue talking and getting to know him. And he felt the same way. And it just kind of progressed quite naturally from there. I think I actually ended up going away for a month, like overseas. It won't be the first person to message, but I think after like 5 days, we both messaged each other and then continued to like message every day while I was away. So in a way, it was a nice way to, really get to know each other and just like talk and ask weird questions because you just
Let the
want
friendship
to
form.
keep talking. Yeah, exactly.
All right. So let's fast forward a few years and you decide it's time to expand the family planning is individual for everybody. Can you maybe tell us a little bit about what that looked like for you guys?
I always say that Poppy, she is a hormonal baby. She was a baby that is a product of my hormones. I woke up one day and I wanted a baby. I wanted it now. If I could, I would have had it yesterday. So I think Scott and I had already had conversations. We knew we wanted children at some point in the future. And it just happened to be I woke up and I said to him, let's do it. I want this baby and I want it now. So I knew that fertility isn't impacted by my spinal cord injury, and I had already kind of talked to other women that had had babies and knew that it was possible. So we just kind of thought, well, let's get going. And I think that there was a kind of maybe a little bit of naivety going into the process about what it would be like. But as I said, it was just this internal desire. And I don't think anyone could have swayed me from that at that time. So, yeah, off we went.
When you say naivety, what do you mean? I think there's a certain amount of naivety that we all have going into having a baby and you're like, oh my God, the reality. What do you think specifically for your circumstances made you think, oh, I didn't think about that?
Yeah, I think naivety and like, yes, I can have a baby, but perhaps how is that going to impact my body and what does that look like for a person with a spinal cord injury, especially a high level spinal cord injury in terms of autonomic dysreflexia, catheter care, and the extra bits, the secondary health conditions that kind of are present, how pregnancy can impact those. I think I went in just thinking, get pregnant, deal with your pregnancy, you have a baby, there you go. I think I went in thinking I'll have a C-section because that's kind of people that I had spoken to I had had. And then once there were so many more options available to me that I didn't know. I had a lack of information on kind of what was to happen or what could happen, how I could give birth. And so just kind of went into it hoping for the best.
So a blessing and a curse in some way. If you had maybe known everything, do you think you would have overthought it?
Yeah, definitely. Earlier I was expecting a second. Poppy is nearly 4. And I think that going through the first pregnancy, knowing what it was like, and also the 4th trimester, that when you've just had your baby and managing that and the parenting, it took me a while to feel like I was ready or in a place mentally and emotionally, also with the supports around me, to feel like I could go through that again. Knowing all it takes on my body, I just knew that I had to be in a certain place to do it again. So yes, had I known, it may have been different.
So Poppy's the hormonal impulsive baby, which is wonderful, and we want those babies too. And then number 2 is the well thought through, very considered, very planned, eyes wide open. Yeah. Okay, so let's just go back to pregnancy for a second. You mentioned some of the things for women to be considering in terms of catheter care and autonomic dysreflexia, and we've talked about that pretty much in every episode. Is the uncontrollable ability to manage blood pressure. What other experiences did you have?
I think the first thing that got me was and that really impacted on my pregnancy was the autonomic dysreflexia that seemingly had no cause. It normally results from you need to go to the bathroom, like your bladder, bowel, you're hurting in some way. I felt just generally clammy all through my pregnancy. And I think it was just my body, your organs are moving, your uterus is expanding. Generally, women will feel uncomfortable. It triggered my autonomic dysreflexia. I get AD when I get my periods, and I think that's just a cramping, and that's just my response. But I think that was very prevalent and was the thing that really impacted on my experience. But then on top of that, you've got to manage your bladder, catheters. I've got a suprapubic catheter. My first pregnancy, it wasn't an issue. This pregnancy, it has been an issue. Just with lots and lots of sediment and blocking. I think you've just got to be aware of all of the ways that pregnancy could impact, because it will be different for every woman.
Yeah.
And it will be different for each pregnancy, but at least having a knowledge and understanding of the things that could happen mean that you are better equipped if they were to happen.
Where did you end up getting all your information from? Did you end up linking back in with the spinal unit, or by then you're living well and truly in the community? So how do you link back in for obstetrics care? Just through women's and children's, like just through maternity unit?
It was just through the maternity unit. So I had an obstetrician that I was in contact with before I got pregnant. So when I got pregnant, I went to see him and link in with him, and he linked me straight in with the maternal fetal medicine unit, which is the unit that looks after all high risk pregnancies. They looked after me throughout my entire pregnancy. I had a midwife that looked after me throughout the whole pregnancy, which was really great because I had that contact if anything could happen. And then they linked into the different services at Royal North Shore. So I think we spoke to the urology. We also had the spinal unit at North Shore that we linked into. The CNC on the spinal unit came down, and we spoke about how we were going to manage being in hospital and bowel routines that I would need during my stay. I'm pretty sure that the spinal specialist was made aware that if anyone had any questions, they might contact them. But the majority of the contact I have was with the midwife and the CNC on the spinal.
Okay, nursing-led care. I remember seeing you were much more reclined in your power chair as your pregnancy went on. So obviously there was an impact on seating as well, sort of positioning to be able to sit comfortably. Is that something that you had to review along the way?
Yes, absolutely. So I think that prior to my pregnancy, I was maybe predominantly a manual wheelchair. So I had a manual wheelchair with power assist wheels. That was predominantly how I got around. And then, yes, throughout the pregnancy, as it progressed, I kind of transitioned into power chair. And that was because another result of the pregnancy is naturally people with spinal cord injuries have low blood pressure, and I suffer from very low blood pressure. Sometimes in the day, I need to put my feet up to manage my blood pressure, and so I could only do that in my power chair, or I'd have to, you get quite tired, and I would put my headrest on so that I could lie down and have a little, 10-minute power nap at my desk, things like that. So it just meant that I could stretch out a bit more. I could put my feet up to manage my blood pressure, and gave me a little bit more security as well with my balance, because obviously in the manual chair there's more free area where you can fall out, whereas in the power chair you've got your armrests, and I just felt a little bit more secure in my position. As soon as you become pregnant, you want to do everything you can to make it as safe an environment for your child as possible. So I think everything that I did was just to make sure that I'm as safe as I could be to eliminate any risk to myself and the child.
Yeah, makes sense. Your maternal instincts kick in straight away, just like, how do I look after this baby? And if that means changing equipment, cool, do it. Okay, so go back to birthing for me. You were saying that there's all these options. Everyone you'd spoken to was had a cesarean, so that was familiar. You knew that was an option. But when you were actually pregnant and learning about your options, what did you learn?
My obstetrician was like, don't have to have a cesarean, you can deliver naturally. There's no reason you can't deliver naturally. If anything, it'd be better for your recovery because you eliminate that extra kind of surgery. That was really interesting, and it took me a while to come to terms with the fact that I could do that. And I think I ummed and ahed for quite a while about what I was going to do because I had gone into it thinking I was going to have a cesarean. And then all of a sudden this option opened up to me, and I thought, well, I don't know, what is the best option? What should I do? And so I thought about it for a long time, and I discussed it with the obstetrician and the midwife, and then my mum is also a midwife, so I talked to her about it. And so in the end, I decided to try delivering naturally. That's the route we took. I'm happy we did in the end.
Yeah, right. I mean, I think the assumption and the rumor that I'd always heard was like, women can't feel labor if they've got a spinal cord injury. That's a big fat lie, isn't it?
Yes. So interestingly, at about 35 weeks, I started experiencing like intense Braxton Hicks. It was to a point where I thought, am I in labor? Like, is this it? And we were called the hospital and said, come in, we'll check you out. I went in and they're like, you are having these contractions, but we think they're just Braxton Hicks. I think they gave me some Panadol and said, let's see how it goes. And it went away. But they said, we don't know whether you will know if you're in labor or not. So let's just keep you here and we'll monitor you. So I
From
thought,
35 weeks.
Fine, that seems reasonable. We sat in the hospital for 2 weeks before I said to the obstetrician, I cannot do this anymore.
Yeah.
I cannot sit in this hospital just waiting anymore. I think I was in tears. I was like, my mental health, I just cannot do it. I was like, because I either need to go home or we need to have this baby. We had passed that 37-week baby's form. Baby's now just putting on weight. And he said, okay, Tuesday, 38 weeks, we'll induce you and we'll have this baby. We already knew that we wanted to have it in a kind of controlled setting where we could do an epidural, manage the autonomic dysreflexia, and have the obstetrician there, not at a random time. So that was the Tuesday. On the Monday, I woke up and I thought, there's something going on. Don't know what's going on. And I got up and I thought I might go get my nails done down in the hospital kind of nail parlor. I went down and she said, I can't do your nails right now, but if you come back this afternoon, I'll do it. And I thought, I'm not coming back this afternoon. And I'm like, I think that this is like, there's something going on. I think that like I either do it now or like I'm having a baby this afternoon. And so I decided, I was like, no, that's all right. Then I went back up to the unit and I said to the midwife, I think that I'm in labor. I think that it feels different. It's not these intense contractions. It's just this like small light tightening. There's just something going on. It feels different. And so we got in bed, we just put the monitor on, and lo and behold, yes, we were starting to go into labor. So it was a very different feeling, and one in which I thought, this is obviously labor. And so at that point we said, okay, well, if you're already going into labor, let's just get the show on the road and we'll do this now. So did the epidural and got things going, and it progressed really naturally from there in terms of, you think, when you have your baby, you got to be pushing and all this puffing and grunting, but my body, I think, very naturally, like the contractions naturally pushed down. Maybe the paralysis, there's some sense of like having relaxed muscles. So I wasn't like tensing against the birthing process. So it kind of started and she just kind of came down with the contractions. And then at the very end, they used like they've got a little vacuum that they put in the head to help pull them out and get the shoulders out. Yeah, she was there before midnight. So it all kind of happened within 14 hours or so.
Yeah. Amazing. Amazing story in terms of when the body is allowed to just do what it needs to do, it knows how to birth a baby, right? And I think like my doula and midwife friends are kind of sometimes saying we intervene too much in birthing, and our fear holds up a lot of the issues, and definitely was for me too. I was like terrified when I was birthing and kind of all of that tensing and working against the baby. So it's interesting that you say maybe the fact that I couldn't tense, let her just come as she needed to come, and your body contract when it needed to contract. And that's very cool.
Yeah,
And so,
I thought it was an amazing process. I mean, my husband and I reflect back that it was probably like one of the most calm birthing experiences that you could have. There was no one else in the birthing unit really around the same time. But we had Poppy and they put her on our chest and we're lying there. And 20 minutes later, another lady comes in and is in the room next to us. And it sounds like there's an exorcism going on. And Scott and I were like, it was like total stark contrast to what we had just been through. And we're like, wow, this is, it's interesting.
Very different experience for sure. So do you think it made a difference in your recovery? Like being able to naturally...
Yeah, I think so. I think it would have made much difference if I had had a cesarean. Not only have you got a baby, but you've got a wound that you're recovering from. And again, I think that would have probably set off my autonomic dysreflexia. The process and the hormones that get released when you deliver naturally help with contracting the womb afterwards. I think that my recovery would have been longer and perhaps more painful had I have gone for a cesarean. Now, that's not to say that had I needed a cesarean, I would have gone for it.
Oh, for sure. Yeah.
This
is not the anti-cesarean.
Yes, my recovery was better for the route that we took.
And postpartum, what's like, do they still keep you in hospital for a couple of days like everyone, or were you allowed to finally go home?
Yeah, we were there for about a week afterwards just to make sure that, everything was okay and that we were managing. But again, I think we had it on the Monday and I was home on the Friday, so maybe it wasn't quite a week. But I wanted to be home before that weekend, like I was done, and I was like, no, we're going. And I think that we'd kind of established that I was managing and recovering and I was in pain. And so I said, I think it's time for us we're not going to gain anything more from being here.
Yeah. I mean, you'd been there since 35 weeks, so I can imagine that being able to go home after almost a month was like, ready. You're ready for your own bed, for your own shower, for your own house. We chat about looking after babies, your high-level injury. What kind of learnings and lessons and feedback do you have about those first few months?
I think those first few months were really challenging because you have your baby and all you want to do is stay in your baby bubble and kind of be alone in that bubble. But because of the support, the morning routine, I've got people coming into the house at 7 o'clock. So even if you've had the roughest night with bub and feeding, wasn't able to like sleep in and just get up and relax and stay in bed, it was still up at 7, people in the house, routine. And I think I'm the type of person at the time where I thought, well, I've got to get up in my chair because I've got to be seen as being up and about and, I don't know, not lazy. But I mean, going into this time around, I'm going to stay in bed all day with my baby. And it doesn't matter. I don't need to get up. Where am I going to go? We had Poppy at the beginning of COVID. I had nowhere to go. We were stuck in home. I should have just stayed in bed. But I had this thing where I was like, no, I've got to get up. I've got to be involved in the sterilizing or whatever it was that was an interesting time. And then of course the first couple of months my husband had off work, so we could kind of just be the three of us, and he did a lot of the physical caring, the nappy changes. He went back to work and I then had support with me from formal support workers, and that again was a struggle because you just want to be able to do things for your baby, but it's not always possible. So nappy changes, burping, you try as much as possible, but sometimes that bub just needs to be held in a certain way across a knee and patted on the back. And I just couldn't do that. And that was really challenging. So I think that anyone going into having a baby as a woman with a high level injury has to just be prepared emotionally to like go through that process. And I think that there's so many hormones going on at that time as well, probably accentuated those feelings. And I just remember feeling like I just want to be left alone with my baby and I just want to be able to do these things for myself, but then not being able to do that. But I think that over time, Bob becomes more stable, less fragile. I could then do more and those feelings went away. But it was just those initial months where Bob is so tiny and fragile and they need that little extra bit of support was challenging.
Kind of sounds like it triggers a lot of grief in some ways, like adjustment grief. You're like, oh yeah, my injury has impaired my hands, so I can't hold her the way I used to. I would have if I didn't have my injury. But I hear what you're saying. You're like,
definitely was an adjustment.
It was an adjustment. Like, and you were someone who pre-baby were doing peer support and quite well adjusted. So I think what I'm hearing here is that adjustment it's lifelong, right? Like there's weird little rites of passage that can bring up things.
Yeah, talk about it in some of the groups that I run. Grief is something that comes and goes through our lives, and there will be times in our lives where we'll go through an experience. In this case, it was having a baby, could be losing a job, losing a family member or a friend, or different experiences that we will go through, and it might just trigger a period of grief and need to go through a little bit of an adjustment. That is fine and that is natural. We all go through things in life. And it's about how we manage and cope and having the skills to do that when that grief is louder and more prevalent in our life. When I had Poppy, that wasn't an experience or a feeling that I thought I would go through, but I really had to pull on those resources and on this emotional support from my partner to kind of work through that and reformulate or repicture. Yes, I can't change nappies, but I do all of the feeding. Yes, I'm not doing XYZ, whatever it was, but the joy that you get from the smiles and the support that you're providing in other ways. I guess it's another point is in like, yes, you might not be the one changing nappies, but how else can you provide support and contribute to the family unit was also a way that I kind of reframed things. And then I think that also with parenting and what I kept telling myself is that babyhood, toddlerhood is such a short period of time in the lives of our children. Is Poppy going to remember that I didn't change any of her nappies? Probably not. Is that going to impact on her formation as a well-adjusted human? Probably not. What I can offer in terms of support, love, education, instilling values, instilling ethics, making sure she has all the right opportunities is going to help form her as a human over and above the fact that perhaps I couldn't do some of those physical things in those first couple of years. And I really had to pull upon that and have that as my underlying motto to kind of support myself during that time.
Such good insights in terms of, what is it that helps facilitate bonding and attachment, and what is it that makes for good mothering? It's got nothing to do with nappies, really. Like, and to be able to kind of talk yourself through that at a time when it's raw and painful and a bit too close to home. It says a lot to the amount of psychological work that needs to happen at that time as well. It's not just birthing and physical recovery. It's also lots and lots of psychological chat and trying to keep it fair to yourself and not beat yourself up in that time. Did you link back into professional support, or did you just kind of navigate this informally with family and Scott?
I just navigated it myself. I've always been an internal processor. I'm not saying that's one of my strong suits. That's probably something that I could work on better, but I'm a quiet internalizer in which I just have to like process things, and when I'm ready I'll choose someone to talk to. Normally Scott, or it's just something I had to work through. I did have a conversation though with my mum about it prior to, whilst I was pregnant, because I think she said she was talking to one of her friends, and the husband said, well, how is Emily going to manage? Like, how can she parent? Can she do it? Like, I don't know. Like, and I think it's very natural for people to question that and wonder. And I think she said something along the lines of similar to what I was just talking about. There's, different ways to mother that are not just physical. And so we did have kind of a chat about that, how people are going to question your parenting ability. How do I feel about that? And what are my thoughts about that? So it was something that had come up and I had thought about, but I don't think it really hit me until afterwards, like after I had Poppy and as I was going through kind of those first months.
You know, what you're talking about comes up in the literature a lot around women with disability kind of experiencing ableism, but often throughout their entire, you know, even from their pregnancy, you know, there's millions of examples of people being told, oh, you're irresponsible for being pregnant, like, or you're irresponsible for having a baby, like at the maternal care. So it sounds like you didn't get that, which is fabulous. You had like helpful, useful, professional help. But yeah, the literature talks a lot about women with disabilities experiencing higher levels of discrimination and ableism and potentially not getting the resources and access to services that they want through judgment and gatekeeping and stuff like that. I think it's important for us to sort of acknowledge that society might have some weird or not really thought through ideas around parenthood. And like your mum's a gem, but like, you know, really thinking about both your reflections and your mum's, just like there's so much more to parenting than physical and, you know, the way that we contribute and be there for our children. And it's not just the first 2 years that matter, you know, it's across the lifetime. So it's been such a wonderful chance to sort of reflect on what is parenting really, you know, in terms of what is it that you can do regardless of your physical abilities. Tell me, now that she's older, have you got any tips for highly injured parents who have active, not even toddlers anymore, she's a preschooler. So, you know, how do you stay in the parenting role when maybe other people are needed to help with some things? Like you're the mum, how do you kind of keep that leadership?
Yeah, and I think it's especially like it's so easy, you know, when you have a lot of supports around you, you know, your support workers, they become part of the family in a way. Like you know, you see them every day, keeping those barriers, or not barriers, but those boundaries in place is really important. And it's been something that's always been important for me, because at the end of the day, I'm the mum, and just making sure things like, I mean, at the very beginning when she was little, I was adamant that I was going to be the one that fed her and did all of her bottle feeds, because it was such a bonding experience. And I think that was really important for me to have with Poppy. Now moving on, things like whenever Poppy asks for something, it's always, well, go ask mum. Like, I think that I try and instill in everyone that I'm the person to come to whenever she asks. If she wants a yogurt, go ask mum. Those really simple things, like they probably know that yes, she can have the yogurt, but it's still, you gotta go ask mum. I think setting up boundaries is really essential. Making sure I walk Poppy to school every day, even if it's raining and the carers are like, well, how about I just take her in the car? Or I still always try and say, you know, let's umbrella up, poncho up, like we're going. Like it's like that part of my role. And some days it has been pouring with rain and I've been like, yeah, we're not walking. But so for me, it's about doing all the things that you would normally do as a parent, school drop-offs, the meals, etc. My carers are here to be my hands. They're not there to make decisions or even comfort Poppy. Like if she falls over, then she comes straight to me, like I'm the comforter. And so I think, yes, that is really important. At the end of the day, all support workers that come in, like I'm very thankful for them, and I'm even thankful that Poppy has them in her life. I think they all care about her deeply and want the best for her. And I think that, you know, it comes back to that saying, it takes a village to raise children. I feel like we are just a village raising Poppy, and she's got a huge village around her that just love her and want the best for her. And I can't think of anything better than that. But there is a balance to that as well.
And it's kind of like any team, you know, people have roles, and there'll be the decision makers, there'll be the people who have the last word, there'll be the people who get to come up with the ideas, and then there's the people that implement it. So in many ways, what you're talking about here is teamwork, and you're the team leader. And so long as everyone respects that and knows that, the team can work fine. But that's the same as like working in the hospital, right? Like you got a team of social workers, well, there's still someone who's at the end of the day, the decision maker for the teams.
Yeah.
It's just a different team. It's the Poppy team.
Yeah.
But it's also the Emily team.
I see our house as like a unit. There's the three of us, there's Scott, Poppy, and myself. It's the support workers come in to help me be a contributing member of that unit. I can't do as much physically, but I am the admin support person of our unit, doing all the grocery shop, all the accounts, all the finances. I'm organising all the dinners, all the laundry, and that's the role that I kind of have taken on because that is how I contribute to the unit. And Scott is the one that is fixing the fences and mowing the lawns and on the playground fetching Poppy when she gets stuck up the top of the treehouse, things like that. And that's just how we run as a unit. And I think that every family, no matter whether you're a family with that someone has a disability or there's no disability involved, it's all about how you can work as a team to function as best as possible as a unit, and that looks different for everyone.
Absolutely. I always say to my kids, different families, different rules, when they're trying to say, like, oh, my friend gets to do whatever. I'm like, no, different families, different rules. This is what works here. This is how our family works. So there's no one else's business. But yours, I guess the only difference is probably you got people coming in and out that at times might feel like there's more eyes on you. All parents get cranky and suddenly you've got an audience to times when maybe your child is being difficult. But that's like, I think one of the challenges for many people when there's support workers coming in and out of the house, it's like more eyes on the inner sanctions of people's family life.
Yeah, absolutely. I think you choose to parent a certain way, and like when you have people coming into the house and you're like, you think, oh, are they judging me for like the way that I'm parenting or like what I'm doing? Like I've allowed Poppy to have a lollipop, like they, But I think that at the end of the day, I don't think any of my support workers really do, but yeah, there's definitely that thought process. There's a lot of people, everyone has an opinion of how things should be done, but then at the end of the day, like you say, my house, my rules, different family, different rules.
Yeah.
This is how we do it here.
Yeah, exactly. All right, Emily, what's your best advice for anyone who's maybe thinking about diving into family planning, thinking about having a baby? Maybe they were a bit scared because they're now eyes wide open rather than impulsively, hormonally going with their heart. So what's your best advice?
I think it's get prepared, talk to people that have had children and get as much information as possible, and then set yourself up with supports and services. Different people need different levels of support. In my case, it's a higher level. I couldn't do this without that level of support. And I think that going into having this second baby, we moved state. I knew that we had to get to a point where we had a strong support network around us so that we could, do it again. Educate yourself, talk to people, make sure you've got support around you.
Yeah. Perfect. The take-home message of this is not the time to go alone. This is the time to lean into all of the resources and help and information that's out there. Fabulous advice, Em. Thank you. Thank you so much for sharing this story. It's not something that we talk a lot about publicly, and the ins and outs of birthing, I think, is like a certain time point. And now, almost 5 years on, looking back, going, oh, yeah, all the things that I've learned along the way that prepare me now to go again second time around. I feel very lucky that we've been able to tap into your wisdom, your life lessons. Thank you for sharing.
No, it's a pleasure. Hopefully someone can take something from it. Yeah, hopefully it's helpful to someone.
All right, we'll see you next time.